Hi, I just thought I'd do a quick dry run to see how this will go. My name is Jennifer, and I am presenting a capstone project called Technology-Based Flow Management in the Outpatient Clinic. This is my project for my Master's of Science in Nursing. My name is Jennifer Friesen. This project is designed to be conducted in the Specialty Care Clinics department housed within a large hospital campus. The clinic interfaces with multiple other environments including inpatient services, primary care, diagnostic services, and a variety of service specific to our population, which our population is veteran services. Prior to initiation of the project, the department had no clear process for workflow management. There are registered nurses, practical nurses, patient care techs, administrative personnel, each with different expectations, work assignments that vary from day to day. No standard work or standard processes are in place for workload or patient flow management. One patient may have vitals and weight, and they need to update their benefits profile, provide a sample to the lab, see a provider, see a nurse for education or a vaccine, retrieve medications from the in-facility pharmacy, as well as engage in a number of other services. And it's the responsibility of the clinic lead, a registered nurse, to manage each step and make sure that it's all completed, reported, and managed correctly. However, the clinic lead may be covering more than one clinic, and throughout the day will encounter multiple interruptions from walk-in patients, phone calls, secure messaging, triage, assisting providers with procedures, serving as a chaperone, etc. Because many of the patients schedule back-to-back appointments, delays and errors result in critical steps being missed. So the staff desire for a new workload process was identified through a series of leadership and organization-driven initiatives, including morning huddle, monthly meetings, department brainstorming sessions. It's important to remember that the call to action came from leadership-driven initiatives, but is the result of satisfaction surveys and communication with staff input, specifically nurse input. Additionally, patient reports indicate current patient flow management or lack thereof is causing patient dissatisfaction and even patients missing all or part of appointments. Finally, multiple measures indicate fallouts that show there's a lack of efficiency as well as poor time and resource management. So a lean process improvement committee designed a new technology-based patient management process to manage patient clinic flow. Customers of the project were identified as patients, staff, and stakeholders. Two major changes were made by the new process. The first is a redesigned team plan for clinic training and cross-training. And the second was a use of a tool to facilitate patient workflows being introduced. And this tool, VetLink, serves as a patient tracker through the various environments as well as a communication tool. The VetLink rollout became the focus of this project. The redesigned team model is being managed by leadership, so here we will focus on VetLink. So the project is to develop a training plan that will support staff use of the web-based program VetLink, particularly because we're working with adult learners here. Ensuring that they have the knowledge is not sufficient. Adult learners will have barriers to accepting a new process, and that will be addressed within the project as well. The audience is the nursing and support staff. So nursing staff is the clinic lead, which is a registered nurse, a check-in nurse who's often an LVN, and then support staff, which might be patient care technicians, medical services assistants, or other personnel as assigned. It will also be available to other team members as appropriate, for example, managers and providers. The theory that this project used is the change management theory as proposed by Kurt Lewin, which describes managing a change process through three phases: unfreezing, moving, and freezing, and addressing forces that influence the acceptance of change, termed restraining forces and driving forces, and of course, equilibrium between the two. Patient experiences with redesigned workflow and or integrated technology resulted in reduced wait time, scheduling errors, improved choice and self-management, and patients report it's easy to navigate, less stressful, has more value, and overall is better than before improvements on review of literature. So it's important to address what a value-added action is, because this is all from the patient perspective. Value-added actions, it's a lean term that means actions that directly improve patient experience. For example, engaging in counseling or education, something where the patient sees the value. Things that are non-value-added would be like documentation. The patients don't see directly the value. The nurse experience with redesigned workflow and or integrated technology associated with improvement, or is associated with improvements pretty much across the board. So improved teamwork, empowerment, staff performance, nurse-patient environment outcomes, and nurse-employee satisfaction scores. The stakeholders. Someone's got to fund basically whatever we do, so we need to see where they weigh in on it. And the stakeholder experiences in the literature with redesigned workflow and or integrated technology is associated with increased nursing time, which is time that nurses are engaged in nursing tasks. So actually doing something that a nurse needs to do, not walking to and from a printer or other non-nursing time tasks. Self-help options, which result in decreased or at the very least not increased manpower hours to pay for the nursing time. And then one small study showed increased burnout, which was in the study associated with basically the process becoming too efficient to where the nurses were not having downtime. So that would be something we need to watch out for over the course of the project. So what we've been discussing up to this point is why this project needs to be done, and now we'll discuss how it will be done. The 3 phases of change management will guide how this project will be done. So the first step is the training plan. In the training plan is the unfreezing phase. So Kurt Lewin describes unfreezing as the phase in which a change manager addresses readiness for change. So readiness includes influences or forces that restrain or drive the change. Restraining and driving forces prevent acceptance or propel a person towards embracing the change. Some restraining forces that have been identified in similar projects include technology-related inconvenience and usage difficulties, staff use of workarounds, inexperience, organizational distrust, or aversion to something new. And an awareness of these forces that have impeded similar projects will help us to address and overcome the forces in this process. So here are kind of the 4 keywords that I pulled out and that I'm going to address specifically in implementation. So restraining forces, lack of comfort with technology, staff access to the application, concerns on how work will be divided, are all restraining forces that we can anticipate with this particular process. Driving forces would be some staff have already been identified as having experience with the program because the program is used in other environments within the facility. Participation and choice. Surveys were used to identify individuals with experience, will be used to identify individuals with experience, to establish trainers and super users, to invite feedback prior to the training, to invite people to participate in the project. Leadership, a strong leader. Our nurse manager in the facility has served in quality management. She's well respected and trusted by department nurses and is fully behind the process, as well as administrative support, which was secured through the lean team that designed the new workflow process. To develop receptive staff, we need to treat our adult learners as adults. We need to connect the requests that they made in the survey with this learning. They need to see how this is what they asked for. This is the realization of those requests. The next phase is the moving phase, in which we conduct the actual training. So in the review of the literature, the movement phase describes the period in which change occurs. It's the where the project is implemented, and communication is essential. There are issues related to ethics, concerns about ethics, technology issues, just connectivity or access or comfort. Adult learning principles need to be considered, for example, helping learners to understand why they need to know something, to feel responsible for their own learning, and to learn from each other's experiences. Best practices include providing a variety of activities and simulation experience. Logistics may include technology-related or scheduling barriers. So these are all things that we need to be considering when actually implementing the training. And these are kind of the keywords that I pulled out of here that I want to address. So ethical. For this project, because we're working in healthcare, confidentiality and HIPAA would need to be addressed. And luckily that has already been addressed by the lean process. So this tool has already been cleared. So we just need to make sure that trainers can assure the staff that this is a safe to use tool. Technology issues. Super users will receive special training on the program. The information technology department will be available for the rollout to confirm access and permissions, and the help desk will be available through the training and indefinitely as a resource. To allow adult learners to be responsible for their own learning and also to learn from their peers, multiple options for training and support will be provided. Best practices include providing trainer presence, facilitating peer coaching, providing clear expectations, integrating a variety of activities, and assembling synchronous as well as asynchronous assignments, and which we are doing, and you'll see that in the example. And then logistics, the multiple options design also allows for scheduling conflicts that adult learners with a variety of schedules are likely to encounter. All right, so here are the different training options for this project. Learners will work with their designated super user or training personnel to choose the most appropriate training option for them. And you can see in Appendix C, there's a guide for how they can determine that. Option 1 is a scheduled training session. This is your traditional lecture style training. It'll be small group and it will be most appropriate for most novice learners. Option 2 is one-on-one with a super user. This will be for learners that are lacking confidence, that have already identified that they don't have confidence, or perhaps they did a training session and they didn't feel good with it, so they need more support. It'll also work for learners who can't attend the scheduled sessions because of conflicts. And option 3 is asynchronous. This is for when the learner is not able to do any of the other training options, or if they are very confident and experienced because they've used the program before, and the learner chooses the time and place. And then for each of these, super users will follow up and support after the initial training when or if the learner requests, regardless of which option they used. So for any of those options, the elements will be the same. We'll have an introduction, which addresses restraining and driving forces as well as adult learner topics. The trainer will review why this change is necessary and discuss the fact that the change originated from staff requests for improvement. Also, the findings of the literature review will be included, such as how nursing staff, patients, and the organization can benefit from the new process. In the demonstration section, the presentation will show how to access, set up, and use the tool. In the simulation portion, student learners will access the tool and navigate to a simulated clinic where they can learn to interact with the tool in a safe way and see the actions of the buttons. In the conclusion, there will be self-help options given, and the trainer will address concerns, supply support, and including the contact information for their super user. Finally, a super user will follow up to ensure confidence in use at the learner's duty station with the actual patients. So with the actual clinics, the actual nurse, the actual patients, they'll make sure that they're actually able to use the tool in the follow-up. So the following is a, pardon me, small portion of the demonstration portion of the project. So this tool here, you see it's pretty it's pretty self-explanatory. So whatever you click on, whichever of these buttons they click on, whether it's the super user demonstrating or if it's the asynchronous tool, it'll work the same. If you click on the first button, call, it describes what this means. So when you hit this, you're claiming the veteran. That means you're going to find that patient. With the clerk is not currently being used. With the nurse, when you click it, here's what happens. These are your options and what it means. And done with the appointment. So that's just a quick example. Finally, the last stage is evaluate and sustain, the freezing stage. Freezing is the stage where a person adopts and institutionalizes the new habit, accepting it as the new norm. And I'm going to need to change how this shows up. But phase 3, the freezing phase, so impact of frequency on changes. So when there's a lot of change, it causes instability and people aren't comfortable with that, makes them not want to change. Ongoing support facilitates sustainability, and ongoing review of measures and outcomes, evaluation of improvement, tangible tools and strategies, all facilitate accountability and sustainment of change. Phase 3 is sustaining the change. So regarding impact, the impact of having changes, too many changes make people feel unstable. So we want to make sure that the plan is transparent from the beginning all the way through the sustainment phase. And that includes adding a new hire orientation or adding this training to the new hire orientation plan. Support, ongoing support, having super user structure, having involvement from informatics, and having access to individuals through the help desk that can always provide 24-hour support for use of this tool. And evaluation, the leadership will have access to compliance reports that are generated by the tool. Leadership will review, will interact with the super users, and super user observations will all be used to support compliance and any kind of training, ongoing training or support that is necessary. Dang it. I missed this slide. So change is uncomfortable. Change can be effective and sustained if appropriately managed. The themes that we come across over and over again in the literature and that kind of guided this project is addressing the concerns and the forces, making sure that we can make change as comfortable as possible, maintaining motion or equilibrium, making it easy to do the change, making the learning process acceptable and accessible to the adult learners, and then plan for stability and sustainment. People want to see the structure for how this is going to continue to work. This is not just going to be the next good idea that gets discarded as soon as somebody else has a good idea. So thank you so much for your time. My resources follow. And for more information, please feel free to contact me at jkfriesen@my.okcu.edu.